Norrie disease is an eye disorder inherited through the X chromosome, impacts male infants either at birth or shortly after. It results in vision loss by disrupting the normal growth of the retina. This disorder leads to the accumulation of underdeveloped retinal cells at the rear of the eye. Consequently, when light is directed onto the eyes, the pupils reflect a white color, a phenomenon known as leukocoria. Within the first few months of life, the irises or the entire eyeballs might shrink and deteriorate. Additionally, there is a possibility of the lens developing cataracts. It is a rare condition, with slightly over 400 cases documented in scientific literature. Roughly 30% of those affected by Norrie disease encounter progressive hearing loss. Furthermore, around 30% to 50% of those impacted face delays in motor skill development, including activities like sitting up and walking. Other potential issues encompass mild to moderate intellectual disabilities, often accompanied by psychosis, as well as anomalies that could influence various bodily functions such as circulation, breathing, digestion, excretion, and reproduction. X-linked recessive disorders disproportionately impact males more than females. In males, who possess a single X chromosome, a single mutated copy of the gene within each cell is adequate to trigger the condition. Whereas, female infants remain unaffected and rarely exhibit any retinal irregularities or minor hearing impairment. For females, this occurrence is infrequent due to X inactivation, a natural process wherein one of the X chromosomes is randomly silenced. Mutation in the NDP gene lead to Norrie disease. NDP gene is responsible for producing norrin protein. Norrin plays a crucial role in the specialization of retinal cells, enabling them to have distinct sensory functions. Moreover, it is engaged in facilitating the blood supply to retinal and inner ear tissues, along with the development of various bodily systems. Norrin is a participant in the WNT cascade, a series of stages influencing cellular and tissue development. For the activation of the WNT cascade, Norrin's interaction with another protein, Frizzled-4, is necessary. Mutations in the Norrin protein hinder its capacity to bind with Frizzled-4, giving rise to the indications and effects seen in Norrie disease. Medical follow-ups help in managing and combating the disease. However, at present, there is no medical therapy that proves useful for the ocular manifestations of the disease, and the general treatments are merely supportive in addressing some of the disease symptoms. Genetic counseling, if extended to all affected families, can be beneficial for them in predicting the prognosis of their disorder. Carrier testing for at-risk female relatives and prenatal testing for pregnancies at increased risk are viable options if the pathogenic variant has been identified within the family. So don't wait and get yourself tested with Vigenomics for a better understanding of your genetic insights.